Hello friends, hi, welcome to my channel The Voice of Nurse. Today we will discuss regarding NHM 2022 July, the staff nurse solved question paper with detailed explanation. Previous videos we already discussed regarding NHM 2023 January recent question papers, and also in 2022 NHM July paper 1 also we discussed. Just please check it once friends. Today we will discuss regarding NHM 2022 July staff nurse question paper. This is actually in 2022 NHM paper 2 friends. Already we discussed paper 1 also. This is part 1 in 2022 July NHM staff nurse exam question paper solved questions and with explanation. Before moving on to topic, small request friends, those who are watching my channel first time, please subscribe my channel, click on the bell icon for further notification. Topic NHM 2022 July staff nurse solved question paper with explanation. This is part 1 friends. First question: in an emergency situation, the ideal place to feel the pulse is. You will see the options here. Option A, apical pulse. Option B, carotid pulse. Option C, popliteal pulse. Option D, dorsalis pedis. In a emergency situation, the ideal place to feel pulse is carotid pulse. Patient, when the victim is having under the low blood pressure, that time we can't feel carotid pulse. The absence of pulse means patient is in cardiac arrest. Then we have to start immediately CPR. CPR means cardiopulmonary resuscitation. Your carotid pulse can be taken on the either side of your neck. Put the tip of your index and long finger in the groove of your neck to feel the pulse in your carotid artery. We can see here the assessment of carotid pulse, not only in pediatric, neonate, infant, adult, all age groups we have to check here only carotid pulse. Let's move on to question number 2. In AVPU scale, P refers to options. Option A, pallor. Option pain. Option C, pressure. And option D, pulse. AVPU. What is AVPU? AVPU means A means alert, V means voice, P means pain, U means unresponsive. Here in this question, AVPU scale P refers to pain. Option B is the correct answer. Alert, voice, pain and unresponsive. AVPU scale used to measure and record the patient level of conscious and assess and monitor the patient brain function and pain assessment also. Here option B is the correct answer. Next move on to question number 3. In all of the following conditions, you can stop giving CPR except. We will see the options here. Option A, when the person is breathing. Option B, when bystanders tell to stop CPR. Option C, when you are too excited to continue. Option D, the scene become unsafe to continue. Here option B, when bystanders tell to stop CPR. Option B is the correct answer. What is meaning of bystanders? Bystanders means related to the family members, friends or co-workers. He or she may know if the patient is ill, they will start CPR. Okay friends, bystander means family members, friends, co-workers, anybody those who know CPR, patient is ill, they will start the CPR. Bystander CPR is emergency CPR administered by someone that close to the situation physically but not a part of an official response team. Here option B is the correct answer. The following condition except stop given CPR is when bystanders tell to stop severe. Here option B is the correct answer. Next move on to question number 4. The pulmonary artery catheter is also called as. Here we will see the options. Option A Foley's catheter, option B Swan-Ganz catheter, option C short-term catheter, and option D indwelling catheter. Option A Foley's catheter. Foley's catheter is, all of you know about it. This is urinary catheterization. We are cathetering urinary. Foley's catheter is urinary catheterization. What is Swan-Ganz catheter? It is also called as right heart catheterization. Okay, friends? Right heart catheterization or pulmonary artery catheterization. It is done to monitor the heart function, blood flow, and blood pressure in the surrounding area of the heart. Here, pulmonary artery catheter is also called as. Option B is the correct answer. Swan-Ganz catheter. Here option C short-term catheter. What is short-term catheter? Short-term catheter means this is also one of the urinary catheterization, like duration of the short-term catheter is less than 14 days. Option D indwelling catheter. One of that left side is present in the urinary catheterization. It is present in the left side in the bladder. It is attaching to a drainage bag. Okay friends, option here pulmonary artery catheter is Swan-Ganz catheter. Option B is the correct answer. Next move on to question number 5. The common causes of respiratory acidosis are all the following except the condition. Means which of the following is except condition for respiratory acidosis? We will see the options here. Option A asthma, option B head injury, option C pneumothorax, and option D diabetes mellitus. The except condition is respiratory acidosis is option D diabetes mellitus. Diabetes mellitus is a except condition for respiratory acidosis. But during the treatment of diabetic ketone acidosis DKA, several metabolic and electrolyte dearrangements can be done, ultimately result in the respiratory compromise, not acidosis, respiratory compromise. So the except condition of respiratory acidosis is diabetes mellitus. Next move on to question number 6. The normal arterial blood pH is, we will see the options here. Option A 7 to 7.5, option B 7.31 to 7.41, option C 7.31 to 7.45, and option D 7.35 to 7.45. Here option D is the correct answer, 7.35 to 7.45. Normal arterial blood pH is 7.38 to 7.42 actually. Here the range is between 7.35 and to 7.45 is the correct answer, option D. Best range for arterial blood pH is 7.35 to 7.45. A pH less than 7 is called as acidic, means acidosis. The pH is greater than 7 is called as alkaline. Okay friends, here normal arterial blood pH is option D is the correct answer. Next move on to question number 7. The responsibility of a scrub nurse in the operating room is, we will see the options here. Option A assisting in gloving and groaning. Option B applying surgical drapes. Option C handling surgical instrument to surgeon. Option D positioning the patient. The responsibility of a scrub nurse. Scrub nurse role is option C handling surgical instruments to surgeon. Here option C is the correct answer. Scrub nurse role will be prepare the operating room for the patient, setting up the tools and make sure the field is sterile. Maintain hygiene and sterility throughout the surgery procedure. Be aware of the patient safety and sterility also. Here option C is the correct answer, handling surgical instruments to the surgeon. Move on to question number 8. The nurse's responsibility while applying the restraints is, we will see the options here. Option A, document the type of restraint used. Option B, document the patient's behavior. Option C, always apply after a written order from the physician except the emergency situation. Option D, all of the above. Here option D is the correct answer. The nurse's responsibility while applying the restraint is document the patient behavior first. Next, always apply the after a written order from the physician except in emergency situations. Next, document the type of restraint we are using to patient. Here option D is the correct answer, all of the above. Next, move on to question number 9. Which of the following nursing intervention will aid to reduce the effect of GERD? GERD means gastroesophageal reflux disease. So, we will see the options first. Option A, lie down after eating. Option B, elevate the head end of the bed. Option C, drink more water before bedtime. And option D, provide semi-solid diet. Here, elevate the head end of the bed is the correct answer, option B. Why? Head of bed elevation to relieve gastroesophageal reflux symptoms. Bed elevation is at least 6 to 8 inches or 15 to 20 centimeters or more. Here, gastroesophageal symptoms we can reduce or relieve the symptoms through the elevation of the head of bed. Option B is the correct answer. To question number 10. An elderly patient is admitted with pneumonia. Which of the following data is greatest concern for the nurse while performing the physical assessment of the patient? This question, nurse responsibility when patient came with pneumonia, what is the assessment? First assessment to be done by the nurse. We will see the options here. Option A, conscious and alert. Option B, clear breath sounds. Option C, capillary refill time greater than 3 seconds. Option D, hemoglobin is 16 grams per dl. Here, option C is the correct answer. Elderly patient admitted with pneumonia, as a nurse we have to collect physical assessment through the option C is the correct answer, capillary refill time greater than 3 seconds. CRT, capillary refill time. In a healthy person, a normal capillary refill should only take a few seconds. But in newborns, capillary refill should only take 2 seconds. In adults, the capillary refill should take only 3 seconds. Older adults takes more than 3 seconds. So here in this question, elderly patient is admitted with pneumonia. What we have to assess? So here option C, capillary refill time is greater than 3 seconds. Option C is the correct answer. Prolonged capillary refill time may be sign for the circulatory insufficiency or patient is having dehydration and also patient undergone shock. Let's move on to question number 11. Puerperal sepsis is the infection that occurs within. We will see the options here. Option A, 6 weeks after delivery. Option B, 8 weeks after delivery. Option C, 10 weeks after delivery. And option D, all of the above. Here, what is puerperal sepsis? Puerperal sepsis is a bacterial infection of the genital tract which occurs after the birth of a baby, occurring within the 42 days of postpartum period. 42 days or 6 weeks after the delivery. Here option A is the correct answer. Puerperal sepsis is the infection occur within the 6 weeks after the delivery. Next move on to question number 12. Puerperium period begins after. Means Puerperium period will begins after the following. Options, we will see the options here. Option A, crowning occurs up to 4 weeks. Option B, birth of the baby up to 4 weeks. Option C, separation of placenta up to 4 weeks. And option D, separation of the placenta up to 6 weeks. Here, what is puerperium? Puerperium is the postnatal period beginning immediately after the birth of a child and extending for about the 6th week. Here option D is the correct answer. Separation of placenta up to 6 weeks. The period is puerperium. Option D is the correct answer. On to question number 13. Hormone oxytocin is secreted by. We will see the options here. Option A, lactifexus tubules. Option B, uterus. Option C, vagina. And option D, pituitary gland. Here oxytocin is secreted by the pituitary gland. Option D is the correct answer. We will see now. Oxytocin is produced in the hypothalamus and is secreted into the bloodstream by the posterior pituitary gland. So, oxytocin stimulates the uterine contractions in childbirth and lactation after the childbirth. Okay friends, hormone oxytocin is secreted by the posterior pituitary gland. Option D is the correct answer. To question number 14. At 20 weeks, the height of the uterine fundus is. You will see the options. Option A, just palpable per abdomen. Option B, one finger under the umbilicus. Option C, midway between xipisternum. And option D, felt at the level of xipisternum. At the 20 weeks of the height of the fundus, uterine fundus is, option B is the correct answer, one finger under the umbilicus. As a nurse, we can know through the assessment of the antenatal assessment. We can know the fundus height, uterine fundus height through the antenatal assessment. Option B is the correct answer. 20 weeks, the height of the uterine fundus is one finger under the umbilicus. Option B is the correct answer. Next, move on to question number 15. Conjunctival xerosis is caused by a deficiency of. We will see the options here. Actually, conjunctival sclerosis means we will know regarding eye deficiency. The eye disorders, the deficiency will most probably vitamin A. We will see the options here. Option A, vitamin A. Option B, vitamin B. Option C, vitamin C. And option D, vitamin D. Here option A is the correct answer. The conjunctival xerosis is caused by the deficiency of vitamin D. Conjunctival xerosis. What is conjunctival xerosis? Conjunctival xerosis is characterized by a dull and dry appearance of conjunctiva with slight wrinkling caused by a loss of goblet cells and also insufficient mucin secretion. The treatment of conjunctival sclerosis is vitamin A therapy or vitamin A supplementation. The vitamin A, due to the inadequate intake of vitamin A in diet. Inadequate intake of vitamin A in the diet, the causes is deficiency of conjunctival xerosis. Option A is the correct answer. To question number 16. Riboflavin deficiency results in all of the following except. We will see the options here. Option A, angular stomatitis. Option B, cheiliosis. Option C, glossitis. And option D, pellagra. Here option D is the correct answer, pellagra. Pellagra is it except condition of the riboflavin deficiency. Riboflavin is also called as vitamin B2. Okay friends, Here, pellagra is a disease caused by the lack of vitamin niacin, means vitamin B3 deficiency is pellagra. Okay friends, not vitamin B2. Riboflavin deficiency is angular stomatitis, cheiliosis and glostitis. Here, accept the condition of riboflavin is pellagra. Option D is the correct answer. On to question number 17. The richest source of vitamin C is, we will see the options here. Option A, roots and tubers. Option B, green leafy vegetables. And option C, amla. And option D, milk. Here vitamin C means the citrus fruits. Here citrus fruit is amla. Option C is the correct answer. Amla is one of the richest source of vitamin C. It is packing 600 to 700 mg of vitamin C into each fruit of amla. So, amla is the correct answer. Eat 1 or 2 fresh pieces of the amla. We can get the daily dosage of vitamin C. Here, option C is the correct answer. Amla is the richest source of vitamin C. On to question number 18. The kind of food on which a person or group lives is called as. We will see the options here. Option A, nutrition. Option B, diabetic. Option C, diet. And option D, all of the above. The group of or a person lives kinds of food is called as diet. Option C is the correct answer. The diet definition is the kind of food one which a person or group lives is called as diet. Here in this question, option C is the correct answer, diet. Next, move on to question number 19. Which of the following is an example for the simple lipids? We will see the options here. Option A, cholesterol. Option B, triglycerides. And option C, phospholipids. And option D, PUFA. Option B is the correct answer, triglycerides. Triglycerides are the simple lipids which constituted one molecule of glycerol and 3 molecules of fatty acids, which is used for energy production. Here option B is the correct answer, triglycerides. But here option D, what is PUFA? We have to know the abbreviation of PUFA. PUFA means polyunsaturated fatty acids. Okay friends. But the simple lipids, here example is triglycerides. Option B is the correct answer. Move on to question number 20. The smaller of protein which are needed for the formation of new tissues is called as. We will see the options here. Option A, essential amino acids. Option B, non-essential amino acids. Option C, linoleic acid. And option D, non-saturated fatty acids. Here, the amino acid help to break down food, grow and repair the body tissues. The essential amino acids is the correct answer. Option A. Essential amino acids perform the important role in body, included the tissue growth and energy production, immune function and also nutrition absorption. Here, the smaller protein which are needed for formation of new tissues is option A, essential amino acids. Next we will see the question number 21. The causative organism of whooping cough is, we will see the options here. Option A, rotavirus. Option B, group A beta hemolytic streptococci. And option C, Bordetella virus. Option D, Corynebacterium diphtherium. Here the causative organism of whooping cough is Bordetella virus. Whooping cough is a very contagious respiratory illness caused by the type of bacteria is called as Bordetella pertussis virus. Here option C is the correct answer. We have to know here options viruses related to the conditions. Here option A, rotavirus is causes of diarrhea. Rotavirus causative organism is diarrhea cause. Next, what is group A beta hemolytic streptococci means? The person will get sore throat and skin infection and minor illness. So, the causative organism of whooping cough or pertussis is Bordetella virus. Option is the correct answer. Next, move on to question number 22. The three distinct antigens hepatitis B virus has or all of the except. Options: option A HBsAg, option B HBcAg, and option C HBvAg, and option D HBeAg. Here, three distinct antigen hepatitis B virus except is option C HBvAg. Hepatitis B virus. HBvAg is detectable in a serum before the liver function test. Here, the except the hepatitis antigen hepatitis B virus is hepatitis VAG. Next, move on to question number 23rd. The anti-typhoid vaccine is polysaccharide is administered yet. We see the options here. Yet the birth, option B. 9 months, option C. 1 year, option D. 2 years. Here, typhoid vaccine schedule in India is included in the list of the mandatory vaccination to be administered the after birth of a baby. The ideally typhoid shot is recommended for children older than 2 years of age. Here, anti-typhoid vaccine administration at the age of 2 years. Option D is the correct answer. On to question number 24. The modes of transmission of malaria are following except. You will see the options here. Option A infected mother to newborn. Option B female anopheles mosquitoes, and option C skin to skin contact, and option D blood and blood products. Here option C is the correct answer. Skin to skin contact, the transmission of malaria except skin to skin contact means the malaria will transfer mother to newborn, and option B anopheles mosquitoes, and option 4 blood and blood products. But here mode of transmission of except the skin to skin contact. Usually people get malaria by being bitten by an infective female anopheles mosquito. Malaria may also be spread by blood transfusion from the infected person, use of contaminated needles or syringes also. Here skin to skin contact the exact condition to transmit the malaria. Option C is the correct answer. Question number 25. Lymphatic filariasis is caused by. We will see the options here. Option A B malayi, option B W Bancrofti, option C B Timori, option D all of the above. Here, lymphatic filariasis is caused by the infection with parasites classified as a roundworms of the family Filariidae. The types of the filariasis is actually here in this option all of the above is the correct answer, because the infection through the parasites, the roundworms family is classified into 3 types. Option B. Actually, option A B malayi means Brugia malayi. Option B W Bancrofti means Ucheracia Bancrofti, and option C B Timori. Okay friends, these 3 causes of lymphatic filariasis. Here Ucheracia Bancrofti is 90% cases of lymphatic filariasis, but Brugia malayi and B. timori is 10% cases of lymphatic filariasis. The most cases is Ucheracia bancrofti. Here lymphatic filariasis is caused by the all of the above. The option D is the correct answer. Question number 26. The word POSDCORB POSDCORB describes the elements of administration in which S stands for. In POSDCORB POS S stands for what? We will see the options here. Option A stopping, option B supervision, option C selection, and option D securing. Here what is POSDCORB? We have to know. POSDCORB. In POSDCORB, P means planning, O means organizing, S means stopping, D means directing, CO means coordinating, and R means reporting, B means budgeting. Planning, organizing, staffing, directing, coordinating, reporting, and budgeting. Here A stands for staffing. Option A is the correct answer. The POSDCORB is created in the year of 1937. Here the S stands for staffing. Option A is the correct answer. On to question number 27. While performing a newborn assessment, the nurse should measure the vital signs in the following the sequence. We will see the options here. Option A pulse, respiration, temperature. Option B temperature, pulse, respiration. Option C respiration, temperature and pulse. And option D respiration, pulse, temperature. Here in this question the newborn assessment to be done in the sequence of measures by the nurse. Here respiration, pulse, temperature. Okay friends, respiration, pulse, temperature. Option D is the correct answer. The normal respiration of the newborn is 30 to 64 minutes. The pulse is, or heart rate is 120 to 160 beats per minute, and temperature 97 degrees Celsius to 98.60 degree Fahrenheit. Okay friends, 97 to 98.4 the respiration pulse temperature. Option D is the correct answer. Next move on to question number 28. Birth. A newborn infant is noticed to have the following findings. Heart rate is 70 beat per minute. Respiratory efforts is poor and irregular. No reflexes, irritability and blue all over the body. What will be the Apgar score? The birth newborn baby is having. The nurse noticed the findings. Heart rate is 70. Respiratory efforts are poor, irregular, no reflexes and irritability and blue all over the body. The Apgar score. What is the Apgar score? The nurse will give. We will see the options first. Option A 0 by 0. Option B 1 by 1. Option C 2 by 2. Option D 3 by 3. Means here 0, 1, 2, 3. Actually the Apgar score is 1 to 10. What is Apgar? Actually I have to explain Apgar. Apgar means A for appearance, P for pulse, G for grimace, A for activity and R for respiration. Appearance, pulse, grimace, activity and respiration. Here 1 to 10 we have to give a score. 7, 8, 9 is the normal Apgar score. Means more than 7 is normal Apgar score. Less than 7 is poor Apgar score. Within the 5 minutes we have to do Apgar scores within the 5 minutes after birth of the newborn baby to give a Apgar score according to the baby condition. Here there is heart rate is 70 beats per minute, respiratory efforts are poor, irregular, no reflexes, irritability and blue over the body. Means option C is the correct answer. Apgar score is 2. Means Apgar score. So baby needs the medical support. Next move on to question number 29. Biomedical waste mixing with cement is known as. We'll see the options here. Option A, incineration. Option B, inertization. Option C, shredding. And option D, autoclaving. Here, option B is the correct answer. Inertization. Inertization is a process minimize the risk of toxic materials spreading in a surface of water by mixing the waste with cement. Here, biomedical waste is mixing with cement means also known as integration. Option B is the correct answer. On to question number 30. Most common cause of maternal death in India means the most common causes of maternal death in India. We will see the options here. Option A, anemia. Option B, hemorrhage. And option C, sepsis. And option D, obstructed labor. Actually, the maternal morbidity, the MMR, maternal morbidity rate is the leading cause. The first primary leading cause is hemorrhage. Option B is the correct answer. Next, second leading cause for MMR, maternal morbidity rate, is infection. Okay friends, here option B is the correct answer. Most cause of maternal death is hemorrhage. Move on to question number 31. Which is not included in the National Population Policy NPP? You will see the options here. Option A, to achieve NRR to replacement levels by 2015. Option B, to reduce NMR 100. Next, option C, 100% registration of birth, death, pregnancy and marriage. And option D, to reduce IMR 30. Here, which is not included means NMR means nuclear magnetic resource. NMR means nuclear magnetic resource. What is IMR? Infant mortality rate. Here, not included in National Population Policy is option A, to achieve the NRR to replacement levels by 2015. Actually, NRR means net run rate. So, this is not related to the National Population Policy. So, option A is the correct answer here, not included in the National Population Policy to achieve the NNR to replace levels by 2015. National Population Policy NPP is started in the year of 2000. So, next move on to question number 32. Which of the following is not a Winslow's concept of community health? You will see the options here. Option A, the sanitation of the environment. Option B, the education of the individual on personal hygiene. C, medical and nursing services to those who can pay for them. Option D, the control of community diseases. Here, Winslow's concept of community health is not included. Option C, medical nursing services to those who can pay for them. Option C is the correct answer. Next, move on to question number 33. The physician orders an IV solution of dextrose 5% in water at 100 ml per hour. What would the flow rate be if the drop factor is 15 GTT equal to 1 ml? We will see the options. Option A, 5 GTT. Option B, 13 GTT. Option C, 25 GTT. And option D, 50 GTT. Option A is the correct answer, 5 GTT. Actually, 15 or 20 GTT is equal to 1 ml in standard micro drip set and 60 GTT to equal 1 ml in mini drip set. Here, option A is the correct answer, 5 GTT. Means 5 GTT means approximately 3 ml per minute. Okay friends. Next, move on to question number 34. Mr. X admitted in ER with diagnosis of subarachnoid hemorrhage. Which of the following is leading cause of subarachnoid hemorrhage? We will see the options here. Option A, embolism. Option B, hypertension. Option C, aneurysm rupture, and option D blunt trauma. Here the subarachnoid hemorrhage, how it will happen. The high blood pressure is the leading cause of subarachnoid hemorrhage. Heavy lifting or straining can cause pressure to the raise the brain may leads to aneurysm rupture. Here option C is the correct answer, aneurysm rupture. We will see the next question. Question number 35. Which position is recommended for the patient who undergone lower extremity amputation? We will see the options here. Left lateral, option B supine with head turned to one side, option C side lying with amputated side up, option D prone position. Here prone position is the correct answer, option D. The prone position means on your stomach is down, your hips should be straight and flat on the bed or floor. The patient should be in the supine prone position with the appropriate use of tourniquet, as this has shown to reduce the blood loss during the lower extremities amputation. Option D is the correct answer. The recommended position lower extremity amputation is prone position, option D. On to question number 36. A 40 years old unconscious patient is brought to the casualty following the road traffic crash. His blood pressure is 80/60 mm of Hg. What will you do first? We will see the options here. Option A protect airway, option B start vasopressors, option C CT scan head, and option D infuse 2 liters of crystalloids. Here the simplest way to ensuring an open airway in unconscious patient is to use head tilt and chin lift technique. Option A is the correct answer, protect airway. The simplest way to ensuring the open airway for the unconscious patient, use a technique of head tilt and chin lift technique, thereby lifting the tongue from the back of the throat. So option A is the correct answer. This is the one of the CPR. Next move on to question number 37. Hand foot syndrome, hematuria and atosplenectomy are seen in which of the float condition? Which of the float condition? Actually here following condition. Which of the following condition? By mistakenly float. Sorry friends. Make sure correction friends. Option A hemolytic anemia, option B inborn errors of metabolism, and option C sickle cell anemia disease, and option D Christmas disease. Here hand foot syndrome, hematuria, atosplenectomy condition, we can see the sickle cell disease, a group of disorders that cause the red blood cells to become a misshaped and break down. Sickle cell disease is inherited group disorder. So here option C is the correct answer. Next move on to question number 38. The following are all unsaturated fatty acids except options. Option A olenic acid, option B linoleic acid, option C alpha linoleic acid, and option D palmitic acid. Here option D is the correct answer, palmitic acid. Palmitic acid is a fatty acids with a 16 carbon chain. It is the most common saturated fatty acids. In here this question 38, following are the unsaturated fatty acid except, means palmitic acid is fatty acids, not a unsaturated fatty acids. So here option D is the correct answer. Next move on to question number 39. The process by which a secondary oocyte is extruded from the ovary after the rupture of mature Graafian follicle is called as. Okay friends, we will see the options first. Option A fertilization, option B implantation, option C ovulation, and option D oogenesis. Here, the process by which secondary oocyte is extruded from the ovary after the rupture mature Graafian follicle is called as ovulation. What is ovulation? Ovulation is the process of mature egg released from the ovary. After its released, egg moves down the fallopian tubes and stay there here 12 to 24 hours. Then it can be fertilized. Ovulation occurs about the 14 days before the starts of next menstrual period. Here, option C is the correct answer, ovulation. Next, move on to question number 40. The normal range of amniotic fluid index is option A 5 centimeters to 14 centimeters, option B 5 centimeters to 24 centimeters, option C 5 centimeters to 16 centimeters, and option D 5 centimeters to 25 centimeters. Here the normal range of amniotic fluid index is 5 to 25 centimeters. Option D is the correct answer. Using the standard assessment method, normal AF is 5 to 25 centimeters, but the less than 5 centimeters is considered as oligohydramnios, and also greater than 25 centimeters considered as polyhydramnios. These are two serious conditions during the pregnancy. Here the normal range is 5 to 25 centimeters. Option D is the correct answer. Next, we will see the part 2 video continuation next video, friends. 41 to 100 question. Exactly 60 questions I will explain in next video. This is NHM 2022 July staff nurse. All questions and answers with explanation part 1. Thank you for watching the Voice of Nurse. Please subscribe my channel. Click on the bell icon for further notification. Please support me, friends. Thank you.